Generally, arthritis starts with just some kind of nagging discomfort, oftentimes activity related. You know, if you jog a little bit further than you used to, or do something a little bit different that your body's not accustomed to, you may notice a little bit of discomfort in your knee. You may notice a little bit of discomfort actually for the hip in your groin. In fact, I see a lot of weekend warriors and really active individuals who come in thinking that they've pulled a muscle, when in fact it's actually hip arthritis that's causing their groin pain. You know, in terms of preventing arthritis, the best thing is to just take good care of yourself. Stay active, but don't abuse your body. Listen to your body. It's going to tell you if you're doing too much. And don't be afraid to be smart and to back off and not push things too hard. It's oftentimes people really hurt themselves when they're exhausted at the end of a day, skiing or hiking or running, that then real injuries occur. And that is a major factor in developing arthritic symptoms and rapid progression of arthritis. The other thing is stay fit, stay healthy. So remain active, but be smart about how you do it. Eat well, stay fit and healthy, because there are certain activities that you're going to put 6 to 7 times your body weight through your knee. And so if you're carrying even just an extra 20 pounds, that's another 120 to 140 pounds of pressure that your knee's going to see that it doesn't necessarily need to. And not only that one time, but every single time you do it. And so some of that can also be cumulative. A patient should come and see an orthopedic surgeon anytime that they feel like they have a problem. Oftentimes, and increasingly, because I think that patients are becoming more aware and more in tune with their bodies, I see people coming in who just want to have an idea of what's going on. Why is my knee hurting? It's not that it's necessarily limiting them. It's not that it's necessarily causing them to have trouble sleep at night or trouble going to the grocery store, but they want more information about what's going on with their body. And I think that that's a very reasonable thing. It gives me a baseline in terms of how you're doing, but then it also gives you information, not only about what's going on, but how you can potentially avoid problems down the road, or delay a surgery, or avoid an operation, and empowers you to know what you need to do to take better care of your body. So the treatment for knee pain that don't avoid an operation or a progression, and what I mean by that is we do as much as we need to, but as little as we have to preserve function and quality of life. Early on, that may mean activity modifications. So if you're going out there and you're doing things very aggressively and your knee's bothering you, then we think of ways that we can still get you out and doing those things, but maybe we modify it. So if you like to go backpacking and hiking, maybe we figure out ways that we put less weight in your pack, or fewer miles, or a little bit less change in elevation, so you're still able to get out and do the things that you enjoy without suffering the pain from arthritis. Other things that we talk about are over-the-counter medications, anti-inflammatories, acetaminophen. And there are a lot of really good medications, believe it or not, that do a good job early on in the process of developing arthritis that still allow you to do the things you want to do, but not necessarily abuse yourself. Physical therapy has been shown in a number of studies, strengthening the muscles, training the nerves around the knee, to allow us to avoid or delay an operation, such as knee replacement surgery. Certainly braces have a role depending on what your specific problem may be, and then also what your activity expectations may be. And then there's also an injection therapy. Now, injection therapy isn't just one injection. There's actually kind of 3 different flavors of injections. The tried and true, the one that's been around the most, is the steroid. The next up would then be what we call viscosupplementation, which is a compound called hyaluronic acid. There's quite a bit of data out on that. And then the newest that's garnering a lot of attention, a lot of excitement, are what we term the biologic injections. Those are going to be the platelet-rich plasma, or PRP, a procedure we do here called lipogems, and then also the amniotic injections. And while there's not a tremendous amount of data out there on it, some of what's out there is very encouraging. So when it comes to arthritis of the hip, it's not like we don't have options up until hip replacement surgery. We have a lot of things that we can do between you identifying or becoming aware that you have hip arthritis and then needing a hip replacement down the line. Probably the biggest one is activity modifications. Avoid those activities that hurt it. You know, I can tell you that I actually have arthritis in my hip, and for that reason, there are certain things that I'm not going to do. So I'm not going to do yoga or Pilates with my wife because I know that some of those movements are actually going to aggravate my hip arthritis. The other thing we can do is we can take over-the-counter medications. Some of those are very effective in terms of anti-inflammatories or analgesics like acetaminophen. And so if I know that if I'm going to be doing something that may aggravate my hip, I'm going to take those medications beforehand or afterwards. The other thing that I personally do is I have a program that I do that I took up from a physical therapist to try and keep the muscles strong around my hip joint. We know that if we have well-conditioned, well-functioning muscles, that's going to help in terms of hip function during activity and then also trying to avoid an operation down the road.